let's examine the perpendicular R alignment, where tooth number 44 is designated as our primary target. Next, using the perpendicular R alignment, I will now prepare the occlusal surface of tooth number 44, while firmly gripping the suction during the process. The operator's body is at the 9 o'clock position, aligned perpendicularly to the tooth axis of number 44. To ensure clear visibility and effective suction, the patient's head is rotated right. In the same manner, to enhance visibility of the occlusal surface of tooth number 44, the operator's body will exhibit a moderate forward flexion along with a left lateral flexion. The fourth and fifth fingers of the right hand obtain a rest on the mentum while the left hand firmly grasps the suction, allowing the fourth and fifth fingers to rest comfortably on the patient's right masseter muscle. The suction requires an outward bending to achieve a more natural left-hand posture. Let's watch the video. Like this. Once the posture elements are properly set, suction can then be initiated. Personally, I prefer parallel to perpendicular alignment for tooth number 44's occlusal prep. This is because the operator's neck stays within a more normal range. The top image shows parallel alignment, and the bottom image shows perpendicular alignment. For parallel alignment with the tooth's axis, there's an advantage. The operator's neck doesn't experience forward or lateral flexion. However, it has a postural disadvantage, where the right arm is significantly separated from the armpit area. The perpendicular alignment below has the disadvantage of requiring forward and lateral flexion of the operator's neck, but its advantage is that the right arm remains stably tucked against the armpit. Therefore, I'll briefly touch upon the fact that there are inherent trade-offs in terms of advantages and disadvantages, depending on which alignment and specific postural elements are selected for each preparation site. Next, let's look at the buccal prep of tooth number 44 using the perpendicular R alignment. To get visibility of the buccal surface, the patient's head is slightly rotated to the left. Likewise, for visibility, the operator's head has a lateral flexion to the left. The fourth and fifth fingers of the right hand are rested on the mentum. The fourth and fifth fingers of the left hand rest on the right masseter. For perpendicular R alignment, the buccal prep of number 44 is suitable, but the lingual prep is not. Therefore, for lingual prep, perpendicular L or parallel alignment offers much better access and visibility, so I won't cover it in other slides. This time, let's look at the buccal prep of number 44 using perpendicular R alignment in a setup where the suction is hooked. Posture elements are nearly identical to the prior slide, but suction is in the left corner of the mouth. This is to keep the handpiece prep on the right side unobstructed. The left hand, now free from the suction's body, gently pulls the obtrugate to aid in ensuring visibility of the buccal surface, which is the target area. Now, we will examine the perpendicular L alignment with tooth number 44 designated as the target tooth for this procedure. I will prepare the occlusal surface of tooth number 44 utilizing the perpendicular L alignment while firmly grasping the suction. The operator aligns perpendicularly to tooth axis of number 44, positioned at 3 o'clock. To ensure clear visibility, the patient's head is gently rotated to the left. The operator's neck is positioned within a comfortable and normal range. With the right fourth and fifth fingers resting on the right zygoma and the left hand holding the suction, the fourth and fifth fingers of the left hand are positioned on the left masseter. When preparing from the lingual aspect, you employ these specific postural elements, whereas when preparing from the buccal side, the collaboration between your two hands is somewhat different, as demonstrated here. Lingual. Buccal. Fundamentally, the suction tip is positioned on the lingual aspect of tooth number 44 to safeguard the tongue. However, it's intermittently moved back and forth to the patient's left retromolar pad area to clear accumulated saliva and water. Personally, regarding the occlusal prep of tooth number 44, I lean towards parallel alignment more than perpendicular R or perpendicular L alignment. In terms of postural suitability, I feel that parallel alignment is the best, followed by perpendicular R alignment and then perpendicular L alignment. Let's look at the lingual prep of tooth number 44 in perpendicular L alignment. To get visibility of the lingual surface, the patient's head is rotated to the right. The rest of the posture elements are mostly the same as for an occlusal prep from the lingual aspect. If I were to rank the suitability of alignments for the lingual prep of tooth number 44, I prefer parallel alignment the most, followed by perpendicular L and then perpendicular R. However, When prepping a single target element, you are not restricted to one alignment and posture setup. You can alternate and switch between a variety of alignments and postural configurations. The clear advantage here is being able to view a single tooth from multiple angles and perspectives. This allows you to uncover even the slightest nuances in the prep that could easily be overlooked when maintaining a single stationary viewpoint. This is one example of an unsuitable posture for treating a target area. When treating the buccal side of tooth number 44, there's no real need to strictly adhere to perpendicular L alignment. Other alignments offer more benefits. Here is a second example of an unsuitable posture for treating the target area. To perform an occlusal prep, the patient's head needs to be turned towards the right, yet the suction apparatus is positioned and hooked on the left side. This is a disadvantageous postural setup for suction, therefore, it's better to grasp the suction instead of hooking it, or alternatively, use parallel alignment. Thus far, we've explored the assistant-free preparation for tooth number 44. Next up, we'll delve into tooth number 46. We appreciate your attentive listening.